Good afternoon, everybody. My name is Josh Houry, and I'm the Community Relations Coordinator here at the Saskatchewan SPCA. On behalf of the One Health Education Committee, welcome. I would like to take a moment to acknowledge the land where I am today. The land on which I live and work is Treaty 4 territory and homeland of the Métis. I honor and pay my respects to the First Nations and Métis ancestors of this place that we now call Saskatchewan. The One Health Education Committee helps improve the quality of life of animals and humans by providing education for animal welfare and human service professionals. This four-part Zoonoses webinar series explores the complex relationship between animal diseases and public health. Today's presentation will discuss important zoonoses and the potential implications related to the importation of companion animals. We do invite you to share your questions using the Q&A feature at the bottom of the screen. If you, again, hover your mouse along the bottom of your screen, you will see a number of options down there, one of which is the Q&A box. You can pop your questions in there, and Dr. Weese will answer your questions throughout the presentation. We will also have some time at the end of the webinar as well to answer any questions that come in. I would like to now introduce today's presenter. Dr. Scott Weese is a veterinary internist and a diplomat of the American College of Veterinary Internal Medicine. He is a professor at the Ontario Veterinary College, University of Guelph, director of the University of Guelph Centre for Public Health and Zoonoses, and chief of infection control at the Ontario Veterinary College Teaching Hospital. He is also a member of the Tripartite Global Leaders Group on Antimicrobial Resistance and runs the Infectious Disease website, Worms and Germs blog, which you can find at wormsandgermsblog.com. Dr. Weese, thanks for being here today.
Great, thanks, Josh. Let's pull up some slides here. They went, there we go. Yeah, thanks for joining in, everyone. So you've heard my topics. I'm going to be talking about importation of dogs and some of the issues related to that. We may have some time to talk about other infectious disease, emerging disease issues. I am happy to answer any questions you have kind of in a general area once we get going. Okay, so we're just going to pull up the chat here. So if you have any questions, please toss them in. I'll try to keep an eye on the Q&A as we go through. Some we can do at the end, but if there's something kind of relevant to jump in at the time, I'll do that. So this is it's a tough topic. It's a, it's kind of a controversial topic. It's a topic where there are a lot of competing interests. And it's one where I'll do one talk. I'll get some people complaining I'm being too permissive, and some people complain I'm being too restrictive. And there are serious issues with importation. There are reasons to move dogs around. And like anything else, we need to figure out how to minimize the risk. When we talk about infection control, we're talking about limiting the risk. We can never eliminate risk. We try to minimize the risk and maximize the benefits. And it's a challenge with importation because it's a very broad area, and we don't understand the risks very well. And we don't really understand the benefits or the needs very well at the same time. So I'm going to try to explain why we have some of the concerns, though. So disease is a lot of us. We worry about animals bringing in diseases. We worry about bringing in animals that are sick. We worried about the risk to the animals that are imported themselves, but to the people that are around them, the other animals that are around them, and then the broader community if it's something that can spread. And there's also the positive aspect of bringing in animals that have pretty poor prospects for life, or at least a quality home where they are. But whenever we move individuals, we move things with them. And those things might be parasites, might be fleas, it might be ticks, it might be bacteria, it might be viruses. Some of those might be things we have here, but some of them might be exotic diseases or things that are very rare or very well controlled here. And rabies drives a lot of the concern. Obviously, rabies is a rare issue in Canada, although people often lose sight that rabies kills about 50,000 people a year internationally, almost all from dogs, mainly in parts of Asia and Africa. So rabies is still a big concern. And there are a lot of dogs that can be moved from areas that have endemic rabies into Canada. And we have imported rabid dogs. We had 2 within the last year and a bit that really probably prompted some of the changes that have happened. 2 dogs that were imported from Iran that developed rabies a while after they got here. One about 6 months after they got here, even though they were infected before they were imported. So we do have significant issues based on severity of rabies, but just a variety of other diseases we can encounter. Some other things, we're just worried about, anything new. This bottom left one, a new strain of canine distemper virus. So a virus we have here, a virus that we control quite well here through vaccination in most areas. But when we know we bring a lot in with imported dogs, and maybe we can bring in different strains. Now, this strain didn't turn out to be anything of real importance. Our vaccines still work, but it shows some of the issues there. Many are probably familiar with the debacle a few years ago with large numbers of largely French bulldogs being imported into Toronto, and a reasonable number of them died, not from infectious disease, but died from just the way they were being imported. But we do see a variety of disease issues that come along with that. And then this one on the right kind of points out, a variety of issues and what the challenges. So this is just one person's report. It was a GoFundMe. And someone that was on vacation in Ecuador and met this street dog, befriended it, and it was sick before the person left. And they took it to a vet and said, okay, well, here's what we can do. We probably can't do too much. So she decided to bring it back with her. So this is Peru. It's a country where we know canine rabies is endemic. We know there are a lot of infectious diseases there. It's a young dog. She brought it back to Canada. By the time it got here, you see it was not responding to noises. It could barely move. So it was taken right from the airport to a referral hospital in Ottawa, where unfortunately it just had parvovirus and needed fairly intensive care. But that animal could have easily had rabies, could have easily had a variety of other things. And good for the dog, right? The ultimate result, if the dog recovered, it's got a good prospect of a life here that it wouldn't have back at home. But what were the risks to people associated with the dog, people handling the dog in the airports, people at the border, people in the vet clinic, a whole range of things. So it becomes a very complex issue. So just kind of summarize some of the issues that we have. Well, we're worried about importing foreign diseases. And sometimes those are a big challenge for us as vets because we just don't see them. And if people aren't thinking about them, we miss the diagnosis. And the same on the human side. If we get a person that's exposed to a disease that we don't have here via a dog, then the physicians may not be thinking about it. Importation of foreign diseases that could become established. So something we don't have here right now, but once it gets here, it could stay. Importation of vectors, ticks, a big concern. We do bring in a lot of ticks on dogs, and they can bring pathogens with them, tick-borne diseases. Just in general, importation of zoonotic pathogens. So zoonotic pathogens being bacteria, viruses, fungi that could be spread from animals to us. And essentially every animal is carrying something that could cause an infection in a person, given the right situation, but some are much higher risk. And then importation, I would say endemic diseases, the diseases that we have here, like distemper virus, like parvovirus, that, we have them here, so maybe it doesn't really contribute a lot to the risk in the community, but we see disease more often because they come in unvaccinated. And if they have exposure to unvaccinated or other high-risk animals, we can get outbreaks that can occur there. And what we often overlook are other things like bites and behavioral issues. A lot of dogs that are coming in as rescues aren't very well scrutinized in terms of their background, their temperament. They may have never been around a kid before. They may have never been around a household situation before. And what's the risk of bite? What's the risk of behavioral issues? And this isn't just discount any of the positive aspects of it, but these are the things that we worry about. So what don't we know? Well, we don't know a lot, unfortunately. We got very little information about what happens, how often, even how many dogs that come into the country. We just don't have data on that. But how often do they get sick? How often do they make someone else sick or another animal sick? What do people do to reduce the risk is really variable, and we don't really understand how widespread some of our prevention measures are. And for me, a big one in the bottom is one that we really need to figure out is what percentage of imported dogs are thriving in a household after a year versus what percentage were sick and didn't make it, were euthanized, had behavioral issues, and were euthanized or surrendered because of that. And I just don't know. I certainly see a lot of the bad things because I'm in a position where I see strange infectious diseases. So I realize I'm pretty biased in what I see, but there certainly are dogs that a lot of effort, a lot of money gets put into bringing them to Canada, and they don't do well. Or people adopt from a rescue and the rescue hasn't been transparent. People have just adopted a new dog and they're in for a very sick dog and thousands of dollars worth of vet bills for a dog that might ultimately die in a few months. And we certainly see that too. And just to show some of the transmission or the new disease issues, this is just from a study we did on canine influenza. So canine flu is the dog variant of the flu that we're worried about. And in Canada, one of the things about canine flu is we just don't have it here. It's something that's present in Asia. It's in the US, it's been brought in from Asia. We have had it introduced to Canada a couple times and we've been able to eradicate it, which is good. We don't have it here, but it means all our dogs are basically susceptible to it. We don't have dogs that have good antibody protection from previous infection, and we have very few dogs that are vaccinated. So when a new virus like this gets into the Canadian dog population, it can really spread. And this is an example of that. This is a rescue in Ontario that was bringing in dogs from China and brought in some dogs with avian flu. And we identified it here in this kennel because we had this big outbreak of disease in dogs in a kennel. And well-run kennel, well-vaccinated dogs, but not against canine flu. Essentially what happened is they were bringing in dogs from China into this rescue, and some of them had flu. One of them was fostered in this household, and then one of those fosters, or the foster's dogs, got infected and brought it to the kennel. And we had multiple other transmissions out of that rescue from daycare, from boarding, from pack walking, and things that went kind of downstream. So we've got a household that had their dogs infected from walking or boarding. They went into the groomers and that infected the groomer's dog. And then the groomer's dogs infected a client's dog. And that groomer shut down for quite a few weeks until it was under control. So instance of bringing in one infected animal could have a pretty wide-ranging impact on a community. And if we don't contain it more broadly. And then there's the zoonotic disease side. So the infections that can go to people from animals. And this is an example from a couple of years ago in BC. And the story was there was a dog that was brought up to BC from Mexico. She was helping work on rescue dogs from Mexico in the US. And one of those dogs was pregnant and she aborted. And the person was handling the puppies, the stillborn puppies, and she contracted brucellosis. Brucella canis is a bacterium. We know it's present in dogs in various countries. We know we import dogs with it. And it does pose a risk to people. It causes brucellosis in humans, just like other brucella we can get from food and food animals. So it's an uncommon situation, but it just, again, shows the risk that happens when we move animals around. But one of the challenges with importation is, or one of the many challenges, is it covers a really, really broad area. So importation includes someone that's, they spend their winters in Florida and they've got their dog. It's just their single dog. It's well vaccinated. It's with them for 10 years and they're going back and forth twice a year. That's still importation. Right? We're moving it between countries. It could be a person moving to Canada with their own pet dog. It could be a person that bonds with a dog on vacation and wants to bring that dog home. It's de facto become their pet on vacation. So they're bringing it home just for them. Could be someone's adopting a specific dog via a rescue. So there's a dog in Egypt and they've met it through a rescue. They've learned about it and they're bringing that dog in specifically for them. Could be rescues in importing individual dogs for rehoming or large groups of dogs for rehoming. But then we get into some of the messier things where we get into importation for commercial sale and puppy mills. And there are massive numbers of dogs that are imported to Canada from puppy mills. And it's been a big problem from Eastern Europe in the past, where hundreds or thousands of dogs were coming in for resale. And people that are purchasing on Kijiji and places like that, a reasonable chance they're buying a dog that was imported. And often they don't find out until later on when they finally get some information on the dog after they've adopted it, or they finally get its vaccine records and it's Ukrainian. So they don't realize that they've got an animal that's just been shipped across the world. And then just like importations vary, so do importers. And these can be, from very good to very bad. We have people that do things really well. There's some rescues that are really dedicated. They put a lot of time, effort, money. They're well funded. They make sure they do things right. There's still going to be a risk, but they're mitigating that as much as they can. And they're using advice. They're taking advice to do it well. We've got some that are well-meaning, but just kind of clueless. And that's maybe a little more insulting than it's meant to be, but they're well-meaning, but they just don't understand the risks and they haven't really tried to find out what those risks are. So they're lax and their risks are being created because they aren't doing things they should do because they don't know about them more than anything else, or they haven't been motivated to do something about them. But then we've got some people who kind of know what to do, but they just don't want to. They'll do the absolute minimum that's required because they don't want to put the extra effort or time or money, or they're trying to do this with no budget. They've got good heart. They're trying to bring a large number of animals. They have no money to do it. They're trying to maximize the animals, but they're maximizing the risk because they're minimizing the precautions. And then we've got people that will mislead adopters and dump problems. There was an interesting series in the Toronto Star, it was the last year, I think, was involved with. And these were reports of people that adopted animals where the rescues knew they were sick, knew they were going to need really intensive care, long-term care, expensive care, and have a poor prognosis, and they were still adopted out without the owners knowing. So a well-meaning owner adopts a dog and they're stuck with a sick dog, an expensive dog, dogs that died a couple months later after thousands of dollars of care because the importer just didn't want to deal with them anymore and wasn't transparent. And we've got some that are focused just on money or publicity. Some are doing it for the PR component. And there is an organized crime component, especially in the US, but there's also thought to be some degree of that in Canada, importing a large numbers of puppy mill dogs. And you might say, well, organized crime and dogs seems kind of weird. But if you can import a couple thousand French bulldogs and you can charge $5,000 or $6,000 for them, do the math, right? There's big money involved in this. So that's the issue, is we've got a range of reasons to import and a range of how it's done. And we need to figure out how to facilitate people that are doing it well in the low risk situations, but also trying to, fix the people that aren't doing it quite as well and get rid of the ones that are doing it poorly, and for the wrong reasons. And there's not one easy way to do that. Just if you're interested in this a little bit more, the U.S. has investigated this more intensively. Just a couple more things that were reasons why we have extra concern about importations. This is an investigation at a JFK airport in New York, one of the main international airport hubs, and they were looking at illegal puppy importation. And just some of the things they found is different tricks that people will do. So one is trying to bypass any restriction import rules, any controls, by claiming dogs are rescues. This is very common. So commercial importers bringing in dogs as rescues, or rescues bringing in dogs as personal pets to try to evade the rules that are there, and rules of documentation. The flight parent issue is something we see in Canada as well, where you're going to vacation somewhere, you can find a group that wants to ship some dogs back, you meet them at the airport when you're getting ready to come home, and they'll load you up with a couple of dogs or a lot of dogs. And when you get to Canada, you say they're personal pets, which exempts them from a lot of the import restrictions. And they claim the dogs to their side. So all you're doing is being a dog mule. And people are well-meaning, but it's being done to bypass rules that might be in place for a reason, or that are in place for a reason. And there's some of the other things that they see is, can't bring in puppies. So you bring in heavily pregnant dogs, including these dogs that will whelp in the airport because they're so close. And again, you think about it, they may have some costs associated with that, but if a dog comes in, pregnant dog comes in with 8 puppies worth $5,000 or $6,000, there's incentive to do that. So we run into a lot of these issues, and which is why we have to be concerned about it. But we also figure out how we don't impact some of the kind of reasonable importation issues. So it's a question I often pose people, and they say, what do you need to import a dog? If I was live, I'd ask that. Most people are going to say rabies vaccination, which is kind of true. Really, what you need to import a dog into Canada is a dog, and not a lot more than that in some situations. Now, we're a little bit different over the last couple of months because the rules have changed, and it's become a lot stricter for certain types of importation. But still, to get dogs into Canada, it can be done very easily. And the big change that happened as of September 28th this year was a ban on commercial dogs from high-risk rabies countries. And I'll get to what that really means in a sec. But commercial dogs basically is anything that's not a personal pet. So commercial dogs include dogs that are coming in for resale. They also include dogs that are coming in for adoption or fostering. So rescues are coming in as commercial dogs. If they're not your dog that you're bringing in, it's a commercial dog. So they're trying to facilitate people moving with their own animals, the snowbirds coming home, the person moving to Canada, the person that's adopted a specific dog when they've been out of the country and coming back, versus people that are bringing in dogs for other situations. And the emphasis has been on high-risk countries for rabies because we don't want to bring rabies in. Now, what is high risk for rabies? This is the list from the Canadian Food Inspection Agency's website. I've highlighted some of the places that we actually we have historically brought in large numbers of dogs. Egypt, with especially golden retrievers, some rescues that bring in large numbers of those, but various breeds, including some really good rescues there, actually. China, large numbers of dogs. Cuba, Dominican Republic, we see quite a few dogs coming in from both those countries. Ukraine has been a hotbed. of puppy mill dogs, particularly in the past. Obviously, it's different now. Moldova to some degree, and what we saw was when there was a ban on importing dogs from Ukraine, huge numbers of dogs started coming in from Moldova, which shows when an issue is you ban importation from Ukraine, well, they just go on a car ride next door to Moldova, and then they get brought in as Moldovan dogs. So again, trying to skirt some of the rules. So we've a reasonably large number of countries where there's a restriction or a prohibition of importation of commercial animals. So one thing that's really good, the CFIA actually has a really useful website if you're looking at importing animals or bringing in a personal pet or a commercial pet. It's actually very easy to use and quite clear for a government website. And it's going to go through a couple of examples of that, so you have an idea what's required. So we'll just go through this thing. You can do it yourself. You just pick the box. So we've got a dog. It's a personal pet. It's 8 months or older. And it's coming from the US. So this is, the snowbird, the person that's gone on vacation with their dog. What do you need? Well, you need a valid rabies certificate, and the dog needs to look healthy. And it's really subjective, but even if it doesn't look healthy, they're probably not going to flag it. And because we're Canadians, we're pretty nice. We say we'd like you to have a rabies certificate, but if you don't, okay, well, just please get the dog vaccinated. So it's not really a hard rule. They're supposed to be vaccinated against rabies. But if they haven't been, you don't get rejected, you'll get asked to get your dog vaccinated. Another example is we got a dog coming in as a personal pet. It's a puppy. It's not a very young puppy. It's 3 to 8 months old. And it's not being brought in by its owner, which is sometimes a flag that, okay, is it really your dog if you're not coming with it? And I put other. So this would be the example that we're running into now is people coming from Ukraine, refugees that are coming from Ukraine. So they've got a young dog, and they've left the country, and now they're trying to reconnect with their dog. And you can see this is facilitated because it's a personal pet. So you need a rabies certificate, you need a certificate of veterinary health. So this is something that's more than just that easy thing we would get for bringing a dog from a low-risk country like the US. And the dog has to be healthy, but it's still relatively straightforward. So even if you don't have the owner coming with it, there are ways to get dogs into the country fairly easily as personal pets. When they're really young, so the 3-month cutoff, 3 months is when we can vaccinate them against rabies. And a lot of the age limits are based on rabies. So we got a dog, it's a personal pet, but it's unable to be vaccinated because it's less than 3 months old. It's coming with the owner. What do you need? Well, you need a dog, right? You need proof of the dog's age. Ideally a vet certificate that says the dog is roughly this. You can never guarantee that, but something that shows that yes, the dog isn't able to be vaccinated yet and it needs to be healthy. So we don't have a lot of restrictions. Other countries are much stricter with that. Cats, those of you that like cats, people tend to care about cats. Largely you need a cat if you want to import a cat. If you have a valid rabies certificate, that's great. Essentially you just need the cat though. And if it's a cat that's less than 3 months, all you need is proof of the cat's age. So we're a lot more lax on cats. Cats can get rabies. The reason we have a big difference between dogs and cats is we don't have a cat rabies strain that circulates in cat populations in other countries. Canine rabies circulates in dogs, kills a lot of people. It's present in a lot of dogs internationally. We don't have that with cats. If they get rabies from a bat or a skunk or potentially a dog. So there's less rabies concern there. So just overall summary, personal pets, not a lot of restriction, even if they're not coming with the owner. Rabies vaccinations required kind of, depending on the situation. Commercial, there are more restrictions. If it's a high-risk country for rabies now, then it's banned. And beyond that, it's harder to bring animals in. There are more hoops, which is probably good to make sure there's something done right, but it is still possible. Now, one of the questions that comes up with the ban that we've had implemented in September is, okay, where are we going to go from here? Is this a permanent hard ban on importation of dogs from those countries? Or will rescues be able to restart down the road? And the impression we get from CFIA is this is just a stop, get things under control, and let's figure out what to do from there. And that's essentially what CDC did in the US. So they are having issues with importing rabid dogs, and they were having issues with false certificates from some countries, false documentation. So they put a hard stop, kind of like we did, but a bit stricter actually, for importation from certain countries, high-risk countries. And then just this summer, they changed the rules to allow it with conditions. And the idea is you make the conditions tough enough that it gets harder for someone to bring in large numbers of dogs for resale. or for rescues that are doing it without any, concern or any ability doing it right, but you're also facilitating people that are doing it right. So basically, we've got the change in the US. The dog has to be healthy, have a rabies certificate, have a microchip, be at least 6 months of age, and then it has to fulfill one of these requirements. And I won't go over the details too much, but essentially what they're trying to say is, okay, the dogs need to be a certain age. We don't want to bring puppies in because that limits, if you don't bring in puppies, that limits the puppy mill component of it, right? You're getting the real rescues, the real personal pets, the real reasons to bring dogs in. And they have to be either vaccinated with a US vaccine done by the US. So maybe they were vaccinated before they went somewhere and they come back, or they have to have a rabies titer to prove they've been vaccinated and have a good response to it. And they have to come into a certain airport, or they have to have come into a certain airport with a vaccine certificate. And if they don't have a titer, they'll get held until they get that tested. So essentially what they're doing is bringing in some hoops that are possible for people that are going to do it right at relatively small numbers, but try to crack down on someone bringing in 1,000 dogs a year to resell. So when we think about whether we're bringing in right now or we're restarting from these higher risk areas, risk reduction is really the key. Like I said at the start, we're never going to eliminate the risk. There's always going to be a risk of bringing in rabies if there's rabies in the country, or a variety of infectious diseases, or behavioral problems, or just generally sick dogs. So a lot of the things we try to focus on is what can we do before the animal leaves? And this really depends on the rescues doing it right and having good partners. And some do and some don't. But what we'd really like to see is a risk assessment for the country. Okay, what's the risk from this country and what do we need to do? So it's coming from this country, so I know we're worried about this disease and that disease. So here's what we're going to do in terms of testing or vaccination or quarantine. Ideally, a veterinary examination. So we're not importing a sick animal that maybe shouldn't be traveling, or at least the person that's bringing it in is duly warned that there's something they're going to have to do when they get here. Isolation before they get shipped out. So you get a chance to see if they're sick, as opposed to finding out they're sick when they're en route or when they get here. Standard stuff: vaccination, deworming, flea and tick control, behavior assessment. There's no use importing an aggressive dog. Right? It's going to come here and bite someone and get euthanized. There's no reason to import it. Or you need to make sure it's going somewhere where they know it's got a behavioral issue that they're planning on dealing with, as opposed to figuring out once it's here. And then maybe some other things, maybe testing rabies titers to see if they've been vaccinated and if they've responded well. Might be heartworm testing. Heartworm's very common in some of the countries that we import from. We look at dogs from Asia. We are about 14% of the imports we've tested have been heartworm positive. And it's treatable, but it's not necessarily easy or cheap to treat, and you want to know in advance what you're getting into. And there might be some other testing. So we want a good plan before the animal leaves to reduce the risk of this animal having problems in transit, and to make sure we know what the risks are when they get here. And then after they get here, it's repeating some of this stuff. So a veterinary examination, rabies vaccination if they haven't had one. And this depends where you are in Canada as well. In Ontario, by law, dogs and cats have to be vaccinated against rabies, and it has to be with a licensed vaccine in Canada. So even if a dog is imported and it's been vaccinated and we're sure it's been vaccinated, if that wasn't a Canadian licensed vaccine, we have to vaccinate them again here. And that does vary across the country. So you need to know where you are when you're importing these things. We may or may not repeat the core vaccines, the typical vaccines we give to all dogs or all cats. And my general line is, unless I'm really confident in the fact that they got vaccinated before they left and that the quality of the vaccine was good, I'll vaccinate them again, just to make sure we get them on track here. Might be heartworm testing again. Even if they tested negative before they left, I still want to test them when they get here. Isolation, how long do we isolate a dog that gets into Canada? So there's not really a straight answer to that. Some things we're worried about, if we isolate them for 4 or 5 days, the risk goes down a lot. Some things we would need to isolate them 4 or 5 months. So often we kind of say 28 days is a bit of middle road, realizing most people won't do it. But if we can get a week or two, then we reduce the risk a lot. Behavior assessment again before it goes into any household, make sure it's going into the right household. Prompt veterinary care if problems develop. And this is recognition that, okay, if you're importing a dog and they get sick, we may need to do things a little bit differently, because there might be some other things we're worried about. If you've got a normal dog that's got a bit of a cough, like kennel cough, I'm not going to worry about testing it. If I've got a dog that just came in from South Korea that's got a cough. I want to test it because I want to make sure it doesn't have influenza and isn't going to cause an outbreak that's going to spread across the country. So we approach these dogs a little bit differently. And then informed consent of people who are getting these dogs. They need to realize what they're getting into. And sometimes they don't. They're well-meaning, but they don't understand the risks. Just skip over that. So a lot of it really, like a lot of things in infection control aren't rocket science. They're pretty straightforward. It's some really basic practices, but it's doing them right and making sure people do them. And that's essentially, I think, where we're going to end up, or hopefully end up with importation, is that we're going to see some loosening of the practices or the restrictions at the federal level, but more of an expectation that people that are bringing in dogs are going to do it right, whether that's a shelter, whether that's a rescue, whether that's an individual person, is trying to find that sweet spot where it's not so restrictive that we can't bring in dogs that there's a reason to, but it's not so easy that people can do it without really any understanding of the problem, or it can do it as a way to import cheap dogs to make a lot of money. So with that, I'm just going to pause here. I was going to talk about some other disease things, but I'm going to see if there are any questions about importation or kind of general stuff, and then we'll kind of move into some other infectious disease topics if we have whatever time we have left. So if you have any questions, toss them in the Q&A or in the chat if you're in there too. Otherwise, we'll move on to some other topics. And if you're slow typing or something comes up once I move on, don't be afraid to type it in. I can always backtrack and cover those. And if you have comments too, based on your experience, I see there were at least one person that mentioned being a rescue there. If you have comments, don't be afraid to speak up. And if you disagree with me, don't be afraid to speak up too. So I'm going to move ahead. But as I said, if you have questions, toss them in. I know sometimes it takes a little while to get them typed up, and I'll jump back to them if any questions come in. Okay, so what I wanted to talk about next really is just emerging disease issues or emerging disease concerns. So, I think we figured out COVID's taught us a lot that, things change, that emerging diseases are a problem, and every new emerging disease isn't a pandemic. But we do have a lot of new emerging diseases, and this includes people, includes dogs, cats, whatever. If I look at the things that I work with on a regular basis, because I just do infectious diseases, what I do now is different than what I did 5 years ago or 10 years ago, because our threats are different. We see new viruses, we see new ability to detect things. So this is a scenario from a couple weeks ago, a couple of months ago, I guess now, that you might have heard about. And this is a report coming out of Michigan, where it was, lots of dogs are sick, lots of dogs are dying. We don't know how many, but it sounds like, we're seeing a lot of dead dogs in a certain area, and they don't know what it is. Some unknown disease. They've got diarrhea, they've got vomiting. They looked a little bit like parvovirus, but they are negative for parvovirus. So maybe this is either a new parvovirus or it's a new virus, but whatever it is, it's causing a lot of problems. And I was getting a lot of calls about that, just general media, but people from Michigan or people that are traveling to or even through Michigan with dogs that are worried about it. And I think one of the things we need to think about anytime we're dealing with a new disease issue, it doesn't matter if it's in a shelter, in a community, globally, we need to think about what the situations might be. And, I can break them into 5 kind of main areas. So it could be a normal disease under normal circumstances, right? Just, diseases happen. We see clusters of disease. We see little outbreaks. You see cold and flu season in people, right? Where we see disease rates go up. It's a normal bug doing its normal thing. We can also have normal diseases that are kind of an unusual circumstances. So something different has happened to allow this thing to spread more, but it's a disease that we know about, and it's doing what we would expect it to do in those circumstances that are just a bit unusual. This third one's increasingly common, and this is what gets really challenging to sort out, is what's an outbreak and what's background noise. So a pseudo outbreak is where people are talking about things and we think there might be an outbreak, but it might just be normal. And the classic example would be, okay, someone's got a dog and the dog gets diarrhea, or a dog gets a cough, right? And it happens all the time. If you look in any town you're in, X% of dogs are going to have diarrhea, they're going to have a cough, they're going to have whatever at any point, just like people. But what happens one day is someone goes on Facebook and say, okay, my dog's coughing and I was at this park yesterday. Has anyone else ran into that? And then someone says, oh yeah, my dog's coughing and it was there last week. And someone says, well, my dog's coughing too. It wasn't there, but it was at the park next door. And all of a sudden now we've got people freaking out that we've got this outbreak going on in a community, when we might, and maybe that park was a focus of infection, but it might just be that we normally have 50 dogs that are sick in this town on this given day. and we don't know about them. And today we know about them because people are talking about it. And this is actually a fairly common problem where we don't actually have an outbreak of disease. We have an outbreak of discussion about disease, but we have to sort those out. Then we start getting into where things are actually maybe new. So a normal disease that's changed somehow. So the thing I mentioned before was that parvovirus, but it was a new parvovirus strain that maybe doesn't respond to vaccines as well, or is more severe, or is a completely new disease. And this is rare, but obviously it happens. So I see a couple of questions coming in. I'll just finish off this parvo story here, and then I'll jump back to that. Most commonly, these are normal diseases doing normal things in normal or unnormal circumstances, right? Typically, common things occur commonly is a good mantra that we stick to a lot. We don't ignore the other things, but most often these are common problems. And that's what this was in Michigan. It actually was parvovirus, and actually was just run-of-the-mill parvovirus. And when they looked at it more, it was affecting unvaccinated or inadequately vaccinated dogs. So dogs that only received vaccines when they were really young, before the age when we expect them to respond really well. So with parvovirus, our core vaccines in dogs, we usually vaccinate them at 8, 12, 16 weeks of age. And we don't get confident the vaccine is going to work until at least 16 weeks of age, because they have antibodies from the mom that might interfere earlier. We vaccinate them earlier in case it works, but we need to keep vaccinating until we get to a point where we know it's going to work. Some dogs only get 8-week vaccines or 10-week vaccines or 12-week vaccines. And those might work, but they might not. And what they found here is the dogs that were getting sick were dogs that hadn't been vaccinated properly. So this is normal parvovirus doing its normal thing, infecting a reasonable number of dogs, because there are a lot of unvaccinated dogs there and people talking about it, which raised the international profile of it. The other thing that was kind of screwy here was their initial parvo tests were negative. And we just know that can happen. Tests aren't 100%. And if you're in a facility and you think a dog's got parvo and your initial parvo test is negative, consider the dog at parvo until you've done some more testing. So we try not to overinterpret tests. So I'll skip over the vaccine stuff there. I'm just going to talk about this. When we talk about infectious disease issues, whether that's in a group, in a household, in a shelter, in a rescue, whatever it is, we've got some really kind of basic things we pay attention to prevent problems from getting out of hand. Again, common things occur commonly. So an animal comes in and it's got a cough. Well, it's more likely one of our routine kennel cough bugs. If it's got diarrhea and it's unvaccinated, it's parvo until proven otherwise. So we need to think about what our common things are. Even if tests are negative initially, we don't want to give up and still think about our common things. But one of the big take homes for me is anytime I'm dealing with an infectious disease, I don't really need a diagnosis to act, because I know what I'm going to do in most situations. If I've got a diarrhea outbreak in a shelter, I can tell you 99% of what I'm going to do, whether it's parvovirus or not. I'm going to treat it like parvovirus, and that's going to cover everything else probably. So we don't need to wait for an answer. You don't wait for the diagnosis to try to fix the problem if you've got logical things you can do to help control the problem, like isolation of sick animals, putting your higher risk animals separate from your lower risk animals, personal protective equipment, cleaning and disinfection, communication, all those routine things that we should be doing all the time. That's really at the core of infection control. And we need to remember that regardless of what the cause is. Okay, so I'm going to jump back to the questions here, and then we'll get any other diseases we have time for. What's one of the worst cases of imported zoonoses you've seen in your career? Well, it's tough to say. So it depends if you're talking worse for the dog or worse for the people or the greatest potential for badness. So if we look, that flu outbreak that we tracked was pretty impressive in that we had a large number of affected dogs. So we had a few dogs that died. We had concern that we brought in a new flu virus we're always worried about it spreading and, mixing up with a human flu virus or a swine flu virus or a bird flu virus. So there are a lot of broad issues there. And I spent a lot of time driving around testing dogs to try to contain it. I deal with a lot of individual cases that can be pretty bad, where someone's brought in an animal and someone in the household has gotten really sick. So we do see serious human implications. From my standpoint in that, I'm involved in the animal surveillance. I'm sometimes involved when the physicians get a question. I have a case where, a physician's got a patient that's sick and they've got maybe an animal link they don't really understand. I kind of get tied into those. I had one last week where we got a person in a hospital in Ontario with fairly serious disease, and it may be linked to a dog, and there may be an indirect importation link there. So we actually have more information on some of the human aspects of these diseases than the physicians do at times. So we kind of get involved there. But I think it's not really a straight answer because there probably isn't the one worst case scenario, but there are some things that have been pretty bad for dogs and some that have been pretty bad for people. So another question here. So with the restrictions involved with the MOU and the CBSA and CFIA about information sharing and numbers of commercial dogs imported into Canada, do we have a reasonable estimate for the number of dogs being imported into Canada each year? Yes and no. So we don't have good numbers for overall importation because it's really not tracked. We actually do have a better ability to track commercial dogs because there's a code for them when they come into the country. So there are some data there, and there'll be some stuff coming out, hopefully not too long. We've been talking with Public Health Agency Canada for a while looking into this, and they've got some data on that. And that's how I mentioned when we saw Ukrainian dog importation stopping, Moldovan dog numbers shooting up. That's because we have actually those data. So what we can say is an estimate of the number of commercial dogs is probably okay. It doesn't capture rescues that are bringing commercial dogs as pets. And it doesn't bring in any of the pet dogs, but we can give a baseline number. And I don't have that number to share right now. But we do have some of that, but it's really superficial. But what we don't have is anything beyond that, right? We can look back and say how many dogs came into Canada and how many came in from this country. Where did they go? We have no ability to track that. And that's one of our concerns. And we see this periodically. So a dog comes in and we diagnose it with something. Worst case, something like rabies. We don't have any way to track other dogs that were in that shipment, other dogs that were on that plane, which might have been someone else's dog that was sitting right next to it in a crate. What we end up doing is going on social media saying, hey, if you brought in a dog on this date, FYI. So we do have some data, but they are limited, and hopefully that information will be coming out in the next few months. There's another one. I'm curious about dogs from countries that have canine diets. Does that affect decisions of dog imports from those places into Canada? Maybe not taking that question well. So there are countries where dogs are bred for meat, and we do bring in a lot of those dogs. China, prior to the high-risk country ban, was a place where we go through and they would, bring in a couple hundred dogs in a shipment from a meat market or from a farm. And here's where you get into, what's the net benefit is a challenge. So there's a difference. So someone goes in and someone in country has been working with someone that's farming dogs for meat, and they convince them to get out of the business and transition to something else. So they buy all their dogs and they foster them in Canada, right? Okay, that makes sense. There's a story there. Someone goes in, they buy 100 meat market dogs without any of that other stuff. What's that? Great market, right? If you're selling dogs, hey, these Canadians will come over and they'll buy 100 of my dogs, so I better start breeding more dogs because they're going to buy more and ship them off to Canada. So this is where you need to think about what is the net effect, right? Is the net effect bringing dogs that don't have homes into Canada and improving the overall situation? Or is the net effect just increasing the number of dogs that are in those countries that would then need to be rehomed? And then what's the implication here in terms of, are we in areas where there are lots of dogs available for adoption, which isn't very common in Canada? Or are there areas where they actually need dogs for adoption? And then the other side is, if we need adoptable dogs in shelters, are there some that are closer and lower risk? So could we import a bunch from Montana? They're going to be much lower risk, but don't have homes than bringing a bunch from Korea. So I don't know if I really got the gist of your question, so feel free to toss it in if I didn't really get that. But I don't think we have decisions based on whether they bring in meat or not. Like restrictions aren't based on whether they're farming the dogs or not. They're not coming in as livestock or coming in as a food product. But those are countries where we definitely see a large number of dogs that are adoptable. Another question there, is education adequate in both vet med and human medicine about zoonotic concerns for importation? What is currently good in curriculum? What could be improved? Well, I'd say they're both bad. Human medicine program is a really, really busy program in a really short period of time. And they just don't get a chance to get into this stuff. So I deal with physicians quite a bit, mainly infectious disease physicians and other specialists, because they're the ones that are tuned into it. And that's a problem because we'll see those opportunities get missed where someone's gone into their primary care doc and they didn't think to ask an animal question. or didn't flag the issue, and it didn't get identified until much later when they got into an infectious disease physician. And even the infectious disease physicians don't necessarily understand some of the things that we deal with more. So I mentioned brucella. So Brucella canis is something we see in dogs, can spread to people. What most physicians don't realize is the test that's used in Canada, well, anywhere for diagnosis of brucellosis doesn't detect the dog version. So if you worked with a puppy, worked with a bitch that had aborted, and then you've got brucella-like disease, and they look at you and say, yeah, you've got something that looks like brucellosis. We're going to test you for brucellosis. If they use the normal test, that test isn't going to work. And it's just not, it's such a niche thing. It's not on the radar. So human medicine, like at the GP level, I'd say zoonotic information is pretty slim. Even getting people to realize they should ask a question. So your physician should be asking you to have contact with animals. If you're working in a shelter, if you're working with rescues where you're working with a lot of animals and higher risk animals, they really should know that you're doing that, because it might change some of the things they would think about. On the vet side, I'm not sure we're a lot better. We are better. We talk about zoonotic diseases more. It's the interface between the human and the vet side that's the challenge, because the physicians get the human stuff and the vets do the animal stuff, and right, that's where we should be. But neither one wants to get to the middle, because we don't have the expertise, or don't really want to, the vets don't want to ask questions about people, and the physicians don't want to ask questions about animals. And the vets assume that physicians are going to take care of the whole thing, and the physicians assume the vets are going to take care of the whole thing. So we leave this big, wide open space in the middle where it doesn't get addressed. And that's the One Health concept, right? We're trying to get more integration, but it's really hard to get anything in a curriculum for vet or human medicine because they're so packed. I can do a guest lecture for infectious disease residents on things like this, and I do that. But getting something into the GP program or your general medicine program is really challenging, because there are 1,000 other things they'd like to toss in. So it's an ongoing challenge for us. And that's why we need people that are working with animals to be their own advocates to some degree. So if you're working with dogs that are high-risk areas, you need to know what those risks are yourself, so you can go to your physician and say, hey, by the way, I might be exposed to this. What do you think, right? And they may not know anything, but at least it sensitizes them, and then maybe they'll look into it. So if you're a veterinary technician and you work with a dog with leptospirosis, a couple of days later, you've got a fever and lymphadenopathy, you should say to your doc, I'm a vet tech. I work with a dog with leptospirosis. Could I have lepto? Right? Because they're not going to think about it otherwise. They may not ask you that animal question. So we have to know at least how to plant the seed. And it's tough, because some positions are really good and some it's just not on their radar at all. Okay, I think, did I get all the questions there? And jump in, Josh, if I missed anything, if there's anything in the chat I've missed. So a couple more minutes. I'm just going to touch on a couple other things here. So I'll do really quickly on monkeypox. Basically, every time we get a new emerging disease, we have to start thinking about, okay, what can this virus, bacterium, fungus, whatever do? Monkeypox seems to be calming down a lot, which is good. But we need to think about what the animal implications are. So monkeypox, as you may know, is a virus where we had this kind of ongoing epidemic in people over the last probably year to 2 years now, it looks like, but something that really got a lot of attention over the last 6 months. Instead of just coming from animals in West Africa, where it normally lives, getting human transmission in other areas, including Canada. So monkeypox virus normally lives in small rodents, squirrels, mice, things like that in West Africa, and people get infected by interacting with them. So interacting with a rodent, a squirrel, bushmeat, and so you get these periodic human infections of monkeypox that are coming from direct animal contact, and usually nothing else from there. But for some reason, it got into the human population really well, spread really well, and we had large numbers of cases in a lot of different countries. And anything that gets into the human population, who are they exposed? Well, other people, obviously, but also our domestic pets. And then we need to think about what's the risk to the animal in terms of health, but also what is the risk of that animal to people? So, if people are getting monkeypox and they're being exposed to their dog, what's the risk of that dog getting sick? And what's the risk of that dog spreading it to another person, or spreading it to a rodent or another animal that might be the reservoir? Because what we don't want to have is monkeypox or other things established in our wildlife in Canada. We want this to be an exotic disease, foreign disease we don't have to worry about. And it's a challenge to get surveillance on this done. So we're doing monkeypox surveillance. It's been really slow, but I'll go in and test animals that have been exposed to people with monkeypox. And there've been a few instances now where it's been identified in dogs. So people have monkeypox and they found monkeypox in the dog. What does this mean in the big picture? We don't really know. The pictures here are on the right. If you're not grossed out, we got monkeypox lesions in a person and monkeypox lesions in their dog. So fairly similar. So just a reminder that if we've got something that changes in the human population, we need to think about it with animals. That was a big thing with COVID. We did a lot of surveillance in animals with COVID, but any emerging disease that we have becomes an issue. So I'm going to just skip over this. I'm going to go to the COVID thing. So this was just a reminder of that same story. So we've got something that's building up in people. What are the implications for animals? And then what are the implications for people that are working with animals? So when SARS-CoV-2 first emerged, very shortly after it was starting to spread in people, we started saying, okay, well, can this spread back to animals? Could animals become a reservoir? Because controlling it in people is one thing. We don't want to have to control it in animals as well. So if it's living in wildlife, it's spreading in pets, it brings in a whole different dynamic. And we do know that a lot of different species are susceptible to this virus, but probably aren't overly relevant in transmission. Deer have been a concern because we know that we've infected deer. And in some places, infection rates in deer have been really high. So somehow it's gone from human to deer and it's spreading in the deer population. So there may be another wildlife reservoir for this virus that hangs around for a while. If we ever controlled it in people, that would become relevant. If this virus always stays in people, then it's less of a concern. But when we don't know which way this is going, we don't know if it's going to be something we can eradicate in people, we'd rather not let it get in the animal population. Now, when it comes to dogs and cats, both those species are susceptible to this virus. Dogs, not that susceptible. They get infected, they don't usually get sick, and they probably are at really low risk for transmission. Cats are a little bit different. Cats can definitely get infected. In our surveillance, what it looks is if you have COVID and you have a cat, about a 50-50 chance your cat's going to get infected by you. Most of the time, they're not going to be sick, but they get infected. Sometimes they're really mildly ill. Occasionally, they have serious disease, but we can, readily infect them, which makes sense, right? I've got COVID. I'm feeling miserable. I'm laying on the couch. I'm coughing away. My cat's laying on the couch with me. It's a great chance for exposure. Okay, so what does that mean downstream? Because cats don't usually get very sick, so it's maybe not a big deal. Can they infect wildlife? So a cat that goes outside and tangles with a raccoon, could they expose a raccoon? Or can cats spread it to other people? And that was a really long-winded introduction to this one case report here. And we've always assumed the cats were able to infect people because they tend to have a fair bit of virus in their mouth and nose when they're infected. But we've always said it's gonna be really hard to figure out if a cat infects a person because there's so much human-human transmission going on. Like, how do you know if you got it from your cat versus you got it from someone else you have close contact with? Because the cat's going to get it from a human contact. And this is a scenario where they actually could prove that. It's just an interesting little story that kind of has a couple things that we should be thinking about. So the story here was there were two people in Thailand who developed COVID. And because of hospital capacity issues, they had to be taken about 900 kilometers away to a hospital. So they got loaded up in an ambulance. Somehow the cat went along in the ambulance. I'd love to know the backstory, but regardless, they went this long car ride. And the two people went to the human hospital. The cat went to the attached veterinary university hospital. And at the clinic, the veterinary clinic, they knew that people were being hospitalized for COVID, so they decided to sample the cat. And the vet that was sampling the cat was wearing a mask and gloves and kind of normal things, but she wasn't wearing eye protection. And when she went to sample the cat sneezed on her, and she got COVID. And the reason you can link this to the cat and not just normal COVID transmission is because they were from that far away. It was a different strain of the virus that was circulating versus where the hospital was. So the owners, the cat, and the vet had this strain of COVID that wasn't the same strain that was circulating in the area where the university was. So it was a pretty solid link the person got infected. So just a good reminder is we can get things from animals. Emerging diseases, we have to assume there's some degree of risk, not freak out, but assume there's some degree of risk. And if you're working in a situation, so if you work in a shelter, especially where you're dealing with high risk situations and zoonotic diseases, we often forget about eye protection. So for me, like if I'm worried about protecting my face because I'm worried about it, like a really high burden aerosol exposure, I need to protect my eyes as well. So when I sample for COVID, when I sample for monkeypox, I'm wearing a mask, but I'm also wearing a face shield or goggles or a combination of both. So it's just routine personal protective equipment done right, and it's the done right part that we often miss. So I think I'll probably stop there, see if there are any questions. I think we're about out of time. But if there are any other questions, feel free to toss them in the Q&A.
Thank you, Scott. That was a fascinating presentation, and I learned a lot. And I too am curious. How did the cat get in the ambulance?
Yeah, it'd be an interesting story. I don't know, it's a long ride to bring it. But
Yeah, no
yeah.
kidding. So this is an opportunity for you to kind of get your last minute questions in for Dr. Weese. So feel free again to pop them into the chat, or use the Q&A feature. And actually, Scott, I'm not sure if you saw the comment here, but Carolyn shared in the chat, just an FYI, there was a One Health session yesterday with the College of Medicine students at the University of Saskatchewan and the vet students at the Western College of Veterinary Medicine. Multiple case studies worked on collaboratively with both colleges. So there's some collaboration happening there.
Yeah, it's starting to come. Earlier this year, I did a couple seminars for med schools at Harvard and UCLA, and just their evening things. So we got just a subset that want to show up. We were talking about kind of some of the applied aspects of it. So it's coming. It's, people are realizing One Health a little bit more. It's just, how do you put that into action, and how do you get sustained change, right? Like, is the one lecture you get in second year of med school or vet school actually going to change your behavior? But if it at least gets people sensitized, and at least gets people thinking to ask the question, that's, I think, really a good point.
Yes, absolutely. We don't have any other questions coming in, so I'm just going to read some information here. We've got some end of session notes. So feel free to get your questions in, because we have a minute or two left. But while we're waiting for questions, I will just encourage everybody to take a moment to fill out the survey. There will be a link popping up here in the chat. Crystal from our office is sharing that, so please feel free to take the survey and let us know what you thought of today's session. If you need a certificate of participation for CE credits, please send us an email. info@saskspca.ca is the email address for that. Also, please take a moment to sign up for our mailing list, where we will send out information for future webinars. That link is also in the chat. And finally, we invite you to join us for the next session in the Zoonoses webinar series. Dr. John Campbell will be presenting a sample of some of the most important diseases of livestock that can potentially cause disease in humans. This session will take place next Tuesday, November 22nd at noon Saskatchewan time, and you can register at the link in chat, or you can visit saskspca.ca/webinars and register for that as well. Dr. Weese, do you have any closing comments?
No, thanks. Thanks for everyone showing up.
Yeah, thank you everybody for being here today. Thank you, Dr. Weese, for sharing your knowledge and insights with us. And we hope to see you at the next webinar. Thanks again, everyone. Take care.